Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Barb Lakey. She's manager of Covenant Healthcare MedExpress. Thank you so much for joining us this morning and calling in.
Thank you so much for having me.
We appreciate you being here. Now, Barb, with everything going on in the world right now, if people have or they think they have an urgent medical condition, what should they do?
Well, Colette, it's a very difficult time for people to navigate healthcare right now. And I know that there have been a lot of offices that have stopped seeing patients in person. Everybody's a little bit afraid to come out to urgent care or the emergency room. But we just want to reiterate that we're open for the public and that we're taking every precaution to keep you, our patients, our visitors, and our staff safe. So at any point in time, if you're ill, if you're injured, and you're not quite sure where to go, urgent care is the best alternative for you in terms of a step below the emergency room, but a little bit more acuity than your family doctor.
So, Barb, when should people use urgent care and when should they go to the emergency room?
So the main thing I want you to remember is the emergency room is there for life-threatening injuries. So anytime that you're in a car accident, anytime that you're having chest pain, anytime that you're having severe difficulty breathing, or anytime that you're having any symptoms of a stroke, you should go to the emergency room. Another thing during this time is if you have been tested for coronavirus and your symptoms are getting worse, the emergency room is the right place for you to go. However, patients who have urinary tract infection symptoms, who have kids like I do, who are being rambunctious and fall out of a tree,
there you go, yes,
or scrape their knee on rollerblades or a skateboard, those are the patients that can come and see us at urgent care. And you have to remember that right now we're also in allergy season, so not every person who has a cough necessarily has coronavirus. And there are community resources to talk through if you need testing for coronavirus, but also if you've gone that route and they said you should be evaluated by your healthcare provider, if you can't get into your family doctor, we're here to see you at MedExpress.
I love that.
So cough and cold symptoms still, sore throats, earaches, minor injuries, minor cuts that require stitches or you want somebody to look at, come and see us.
Those are great tips.
The other thing that's important is
let me ask you
if
this,
you're
Barb.
not sure where to go, we're there to help you answer those questions.
Okay.
Even if you just call one of our locations to talk to the staff there and ask if that's something that can be treated at urgent care, we could help you with that. But definitely, if you get to our door, we're going to see you. We'll help you find the right place to get care.
And people always want to know that. And that leads me into my next question, because people are concerned about this, too, about going to urgent care, going anywhere now. What steps is Covenant MedExpress, what are you doing to ensure things are clean and safe for your patients?
So that's a good question. Yeah. So things will look a little bit different and feel a little bit different for the next little bit when you come to a MedExpress. One of the first things that you're going to notice is that at the door, you're going to be greeted by an individual from MedExpress who's going to ask you some screening questions. And those questions are going to be particularly related to what you're coming in for and what kind of symptoms you have, and whether or not you've been in contact with someone who has COVID-19, or if you yourself have been tested for COVID-19. Now, we're doing that to, one, minimize any risk that is to any of our other patients, but also to our staff. We will check your temperature probably when you come to the door, and you'll be asked to wear a mask. For this interview, I get to take my mask off, but later on, I'll show you, we're all wearing masks. So our doctors, our nurse practitioners, our x-ray techs, our medical assistants, we are all wearing masks, and every one of our patients and visitors that comes in will wear a mask. Because if both of us have masks on, the risk of transmission, even if we don't know that we have coronavirus or influenza or anything, is greatly reduced. So that's the first thing that's going to happen. It's going to look a little different. You're going to ask some questions, and we're going to have masks on. Another thing that we do at the MedExpress and Fast Care locations, as well as all throughout the hospital, we're disinfecting everything with bleach solution every hour to 2 hours. That means everything. door handles, sink faucets, countertops. Obviously, in between patients, exam rooms get cleaned, but the waiting room gets wiped down every 2 hours. Handrails, the tabletops, the chair handles, everything. Another thing that we've implemented, our screener can give you the option to wait in your car if we don't have an open room available. So we'll take your name and we'll take your cell phone number, and we have a secure texting application where we can text you and say, "Hi Colette, it's time for you to come in and start your appointment." So if you had to wait at all, you wouldn't have to wait in the waiting room. You can wait in your car. Obviously, I've talked before about our online sign-in option, and that's at covenantmedexpress.com. You can see our wait times, but you can also sign in from home. So you could wait for a more convenient time at your own home, or if you come in, we'll know that you're coming.
I love that. Thank you so much, Barb. You have great tips, and it's another great option for us out there in the community. Yep. Thank you so much. And if you would like any additional information on today's topic, just head on over to the hot links page of WNEM.com.